I'm now excited to introduce our moderator and panelists for the upcoming discussion. First and foremost, we have the always inspiring Reverend Lennox Yearwood Jr. as our moderator. Reverend Yearwood is the president and founder of the Hip Hop Caucus. On the panel, it's my personal pleasure to introduce Dr. Georges Benjamin, Executive Director of the American Public Health Association. We're also joined by the energizing voice of Keya Chatterjee, Executive Director of the U.S. Climate Action Network. I'm also pleased to introduce Dr. Elena Rios, President and CEO of the National Hispanic Medical Association and President of the National Hispanic Health Foundation. And our final panelist, my newest friend, Mr. Hilton Kelley, founder and director of the Community and Power and Development Association. Reverend Yearwood, the floor is yours.
Thank you so much, man. I'm so excited for this panel and our conversation, how the next administration should deal with COVID, climate change, and racism. Well, let's get right to the conversation. So for all of you who are on our amazing panel, how do you see COVID, climate change, and racism interconnecting? Dr. Benjamin, I'll start with you.
Hi, Reverend Yearwood. Thank you very much for having me. You know, what we're seeing, of course, is this intersection that all of them result in inequities in health outcomes. Clearly, COVID has demonstrated that people who have chronic diseases who are disproportionately impacted get sicker and die sooner. We know that climate change does exactly the same thing. It leaves people who are most vulnerable, who have contributed the least to these problems in our climate with poor health outcomes. And, you know, and racism obviously is the original sin, which has contributed to both, because it drives many of the upstream entities that resulted in these disparities in the first place.
Thank you so much for that. Hilton, you want to give us a little piece on that as well?
Yes. Well, you know, for many, many years, our communities have been plagued with systemic issues when it comes to pollution. As a matter of fact, many of our communities are located next to refineries, chemical plants, CAFOs, which are hog farms, wastewater incineration facilities. And when you're located in these type of areas, well, what you'll find is that people are being subjected to tons and tons of chemical emissions or toxins that exacerbate the body and respiratory system and your reproductive system, and also your immune system. And so we have been forced to live many times in these areas since the Emancipation Proclamation was signed. African Americans have been placed in areas where they knew these areas were toxic. They knew these areas were low-lying, but due to systemic racism, we had to live in those communities. And now what we're seeing, fast forward to 2020, what we're seeing is that those vulnerable populations are becoming subject to COVID-19 due to the long impacts on our systems, which has degraded our systems, our liver, our kidney, our respiratory system. So now people with pre-existing conditions, which in my eye were caused to no fault of our own, but we are now more susceptible to COVID-19. And I think that it's up to our federal and state governments to do everything they can to sort of right the wrongs that have been plagued upon our communities, people of color communities, for many, many years.
I love that. That's real talk. Dr. Rios?
Yes, I have to agree with what's already been said. I'm Elena Rios, President of National Hispanic Medical Association. We have so many doctors and nurses and dentists in our communities that nobody ever hears about, who really care about their families and our communities and know, you know, from their own experience, how we have grown up in, I'm from the greater East Los Angeles area, living in Washington, D.C. now, and know that we are all from areas across the country that have been part of I don't know, detrimental air quality, not having public transportation, not having food, and being a part of these poor environments that have really, resulted in our elderly, especially after years of living in these environments, having less immunity and less able to fight the COVID-19 pandemic. And it's about time that our policymakers and the new Biden-Harris administration reverse those trends and really help to have a healthy, equitable community as outlined in this LANCET, this great LANCET report.
Indeed, the report is powerful. I encourage everybody, if you haven't read it yet, please take time to read that report. My dear sister Keya, your remarks.
Yeah, I mean, as folks have been saying, communities have been made vulnerable. This is not an accident. It's not an accident that the very same communities are most affected by COVID and climate change. And when you think about the need to evacuate, whether it's from a large wildfire, from a hurricane, from a typhoon, that becomes really dangerous in the context of COVID. So of course, these are overlapping crises that are happening at the same time. I also want to just look at the other side, the flip side of this, which is that the solutions are also the same. And so there's something out there called the Thrive Agenda, the Thrive Resolution, which a lot of groups are backing about how we can actually get out of the economic crisis that we've been facing with COVID and deal with all of these threats together at once by creating lots of jobs, by fighting inequality, by investing huge amounts of resources, 40, 50% in Black, Brown, and Indigenous communities, and really healing the nation-to-nation relationship with sovereign and native nations, combating environmental racism, and averting climate and environmental catastrophe, even while we invest in the public health infrastructure and care jobs and really start to see those as green jobs. And we can, in that way, get out of these overlapping crises all together and at once.
Thank you for that. I mean, it's so important. Sometimes in a movement, we want to be revolutionary, but you brought it home, making sure that we are solutionary. I love that. Hilton, I want to come to you with this question. What worries you most about the health risks of climate change on your neighborhood in Port Arthur, Texas?
Well, what worries me the most about the health impacts and the impacts of climate change is the fact that we have a large number of people that are being displaced due to climate change effects, meaning we have a disproportionate number of homes that have been flooded due to chronic flooding. And when I was growing up here in the city of Port Arthur, yes, we would get flooding periodically, maybe 1 or 2 years. It would skip, but now what we're seeing is chronic flooding every year. We're seeing the waters getting higher. Our summers are becoming hotter as well. And the waters, when they come in now, it's coming in maybe 3 or 4 feet. And now areas that historically did not flood are starting to flood. We had our low-lying areas, and then we had our high ground areas. And now the high ground areas are seeing 2 to 3 feet of water as well. So many people are being displaced, and families are having to buckle down and learn to work and live together, literally in one home, which also brings about other problems.
Thank you, Hilton, and thank you just for your activism. I mean, you as an actor and activist, you are the true meaning of what we call an artivist. You hold it down for Port Arthur, Texas. You are amazing. Dr. Benjamin, the report notes that climate health impacts are often overlooked or even forgotten. What climate impacts on health should be getting more attention?
The way I think to think about this is that before something bad happens, we know the meteorologists get on TV and they tell us that it's going to be hot and there's this risk of wildfires. And then, of course, the wildfires hit and there's all the drama around the wildfire. Or that there is going to be a severe storm coming. We watch these storm systems develop out in the Caribbean, and they come across the waters, and we all count the days and all braced for it when it was going to happen. People board up windows, et cetera. And then after all the damage is done, everybody goes away. And what is left sometimes years later, particularly in under-resourced communities, generally communities of color, is the blue tarps are still there. We still have people living in homes that are now been flooded and now are mold infested, and people are struggling just to get up every day and breathe. They may not have an effective roof over their head. Their recovery is much slower in those communities, and not just by days, but often by weeks and sometimes years. And so people end up in places that are not safe to live in because it impacts their respiratory systems, in communities that are totally devastated, and economically they end up getting devastated. And then the mental health aspects, which always has a long residual in any kind of emergency situation, often never get adequately addressed. And so the post-traumatic stress syndrome continues to be a big issue for many of those communities. And even issues on episodic problems with water quality. In many of these communities, the water quality wasn't the greatest to begin with. But then after an event like this, they continue to have episodic problems with just access to basic services. So those communities were not invested in to begin with, and then a tragedy hits. It undermines the basic standard of living and health for those communities. And then, frankly, our society walks away and says, you're on your own. And then, of course, a year later, we do it again. That tragedy thing repeats itself. And then we ask ourselves, why can't these folks simply pick themselves up from their bootstraps and move on? And as Keya and the other speakers have pointed out, we have designed this situation to be exactly what we get as we go forward.
That's powerful, and thank you for saying that. As somebody who is originally from Louisiana and saw my family and friends literally drowning in Hurricane Katrina in the richest country in the world, that post-traumatic stress, that mental health component is real. I've seen that for the past 15 years on my family. So thank you for lifting that up. Keya, I mentioned earlier how we had to not only be revolutionary, but solutionary. So what are examples of grassroots climate victories that have resulted in safer and more equitable communities?
So many, and I would be remiss if I didn't point out that you and the other panelists have been a part of so many of these. But grassroots people power is what it will take for us to get this large-scale transformation that we need of our society to address this crisis and all of these crises together. And we see that it's been working for our communities. So we've had pipelines stopped, the Atlantic Coast Pipeline, the Dakota Access Pipeline, the Keystone XL Pipeline. We have had huge divestment wins where we've had, institutions taking their money away from the fossil fuel companies that have actually been trying to prevent the very clean energies that would get us, better public health outcomes. And so those divestment wins have been numerous in the past year. Some very, very big wins there of huge pension funds taking their money out from those corporations. And just last night, there was, I just saw the Oakland City Council voted to move away from gas, which is a huge move because not only is gas a fossil fuel and that contributes to climate change, but it also has these indoor air quality effects when we use gas for cooking. That have been shown to be really harmful immediately to the community. So it's just an immediate benefit from a public health perspective to move away from these pollutants. And so I think that what we see over and over again is that it is the communities that are most affected that are also the communities that are most powerfully rising up and getting wins for their own people and their own communities. And we are just at the beginning of this journey. We have a long ways to go. It's exciting that we have a new administration, but it's kind of like we're at the beginning of Star Wars, and we have the plans to the Death Star, but we haven't actually done it quite yet. And so we have a lot of work ahead of us. But it gives me great hope, the wins that we've already have, and the incredible leadership we see from grassroots leaders from around the country and in their communities.
Well, that gets me excited hearing you. That gets me pumped up, man. When I hear that, I know we have hope, man, because this is just a critical moment for what we need to do. And shout out to all the grassroots who've been fighting in the trenches and winning, man, so many hard fought battles. Dr. Rios, what steps can community members take to protect their health during COVID, especially if they live in neighborhoods with poor air quality?
I'll move. No, no, I think honestly, we need as a community to rise up with education from our community leaders to understand the connection between poor health because of the poor air quality, because of the power plants in our communities, the power plants that put out oil and gas and methane. So those are the connections that need to be made. And then secondly, in terms of health care, we need affordable, bronchodilators, the asthma treatments that are so needed in our communities. And then we have a lot of diabetics and people with heart failure that end up having water in their lungs, so they catch pneumonia easier. So we have a lot of young people and older people in our communities that are affected by poor air quality that need better, affordable medications. They need to have doctors and nurses, access to people that are able to reach them, that look like them, in order to have a more comprehensive change in our communities to be able to fight off COVID-19 and other pandemics that will keep coming. The second thing I would just say is that in our agricultural areas of the country, many of our poor people, poor communities, it's not just Latinos, but African Americans, Native Americans that are working in agricultural areas and rural areas, they even have less access to treatments for their lung diseases that are impacted because of the fertilizers and because of the pesticides that they have to breathe in working. And I just think that overall, the community needs to have public-private partnerships from the new administration. I know we're going to talk about that in a minute, but I think we really do need a public-private focus on building public health. The people and the whole community need to be healthy, not just one-on-one, one person going to a doctor. We need everybody to understand what healthy lifestyle is.
Thank you, Doc. That's very powerful. One of the hardest things that I ever had to do was to bury a little girl who died from an asthma attack, and her mom had to choose between paying the light bill and paying for an inhaler. And the whole time I was doing that funeral, that mom was trying to climb into the casket. So it's real. I mean, our people in the streets are dying. So that's real talk. Thank you, Doc, for that. And to what you said, let's speak to this new administration, because it's not a game that we're playing, and we need real solutions and them to make real policies. So this is for all of you, and also tell folks how to reach you too as well. This is our last question. So President-elect Biden and Vice President-elect Harris campaign on climate justice, and climate justice is racial justice. So what message do you have for them as they prepare to take office? My sister Keya, you started off.
Thank you. I think that my message is for them to keep in their hearts and their minds every day the faces and the people of the people out there who are suffering, whether it is the story that you just told of the child who died from the asthma attack, whether it's families who've not just had their homes turned to ashes, but their entire community turned to ashes, families who have over and over had their homes flooded and are struggling with mold, families that have multiple people die from cancer, families without clean water, families who are waiting in line hours to get food. We need those voices to be inside and really heard by the Biden administration. And the most important thing to me is that they be bold and that they be brave. The odds are not necessarily with us that we will be able to tackle all of these issues at once, but we have to try and we have to have the courage that meets the moment. And so my biggest message is to be brave, to be bold, and to never forget who you're fighting for and never forget who put you there. They ran on these issues. They ran on climate justice, on racial justice, on economic justice. And now, and we voted for them for that reason. And we put them there. And now we need to see a level of action that is unprecedented because that's what the moment requires. We need to have the courage for the moment we are in right
now. Thank you. Hilton?
Yes. I think that what I would like for this administration, the incoming administration, to adhere to is the fact that we must keep pressure on the ground. We must keep community voices at the table. I had the pleasure of working with Gina McCarthy under the Barack Obama administration and Lisa Jackson, but we worked on the startup shutdown malfunction rule, and we were successful in getting the startup shutdown malfunction rule put in place, which helped to reduce tons and tons of toxic emission from the fossil fuel industries. And when that rule was put in place, we started to see a change in communities. I would like to see the Biden administration pick back up on the work that was being done prior to the Trump administration, because we were making some great headways. We were getting a lot of enforcement action. We were getting a lot of laws put in place, which helped to protect human health and our environment. And I think that if we pick back up on what Gina McCarthy and Lisa Jackson were doing under the Barack Obama administration, I think we'll be on the right track to furthering that work and saving lives and saving our community and reversing the impacts of climate change. And lastly, definitely let's get back involved with the climate agreement, the Paris Agreement, and get back with doing our work with helping to reduce carbon emissions globally. I think it's critically important that we take the lead on that and keep the lead and help the world to understand that we are back in the saddle.
Come on now, we are back, we are back, we are back. I love it.
From Texas,
that's
back
right.
in the saddle.
That's right. Dr. Rios?
Yeah, I echo that. I also, with the Obama administration, our National Hispanic Medical Association was very proud to sign an agreement with Gina McCarthy and the Environmental Protection Agency at one of our national conferences. She met with our board of directors, and I have to say that that agreement included the open door policy that she always had with having our community members come to meet and testify. I was involved in meetings with people from the farm workers from across the country, meetings about carbon emissions, meeting about just lung diseases and asthma. And there were so many opportunities to provide input. That's what we need to continue to have a targeted discussion, but also targeted resources that will help build the public health infrastructures needed in our communities and education that we talked about. And I think the most important thing is that the Biden-Harris administration realize that environmental policy is needed, like was said, in a very bold way right now, and we're all here to help.
I love it. We're saying hip hop can't stop, won't stop. Dr. Benjamin, bring us home.
Well, we're all really excited about the work we're going to be able to do over the next 4 years to try to enhance the health and well-being of our communities. The president and elect and vice president elect ran on a model of building back better, and I would hope that that slogan means building back healthy and building back with equity. If we do that, so that we have a better society, that our infrastructure gets improved, but that we do that in a way that it reinforces both health and justice, not just equity, but justice, then I think we're going to have a marvelous future. And I think all of us are going to continue to advocate that we do that over the next several years.
Well, thank you all for this powerful discussion. I want to thank all my guests, Keya, Hilton, Dr. Rios, and Dr. Benjamin. We push on. God bless you all. All power to the people.